going to be talking to you about Central Auditory Processing Disorder, or CAPD. Is your child currently being tested for CAPD? 2 to 3% of children have been found to have this disorder, and it is twice as prevalent in males. Auditory processing is how the central nervous system uses auditory information. CAPD is when the brain and ears don't communicate well and the auditory information gets lost in translations. It is important to keep in mind that a person with CAPD may not have hearing loss. Some symptoms of CAPD are having a hard time understanding speech in noisy environments, following long conversations, reading and spelling, following multi-step directions, maintaining focus, and remembering spoken information. CAPD is commonly confused with ADHD, dyslexia, and autism. People involved in the care of someone with CAPD are audiologists, speech-language pathologists, and the classroom teacher, a psychologist, and don't forget how important you are to helping out your child.
Hi, I'm Christina. I am an audiologist. As an audiologist, I will be aiding in the diagnosis of CAPD. I will begin with a hearing evaluation. Although it is uncommon for CAPD clients to have a hearing loss, it is always good to check. Next, I would do a series of electrophysiological tests. These tests measure how the brain is processing in the sound once it gets to the auditory nerve. The test can be verbal and nonverbal. Also, patterns of numbers and words are usually the stimulus.
Hi, my name is Hannah, and I'm a speech-language pathologist, or SLP. As an SLP, working with children who may possibly have CAPD, I often run behavioral tests. Additionally, I focus on how the child can sequence events, such as reading a story and then telling it back to me so I can check the sequence of the events. I will also take a language sample where the child will just talk to me for about a minute to see how the child's language is affected by CAPD. Additionally, I will give standardized tests regarding language to once again see how CAPD affects a child's language abilities.
Another professional that may be involved with a child who may be diagnosed with CAPD is a psychologist. The psychologist would do many tests, especially cognitive tests such as an IQ test. However, I, the parent of a child who is diagnosed with CAPD, have a very specific role. I am the biggest advocate for my child. Together with all of the health professionals and educational professionals mentioned beforehand, we form what we call the IEP team. This team makes an individualized education plan, or an IEP, for my child. This ensures that my child gets the best education possible. The important thing to take away is that you are the biggest advocate for your child so that they can get exactly what they need.
Now here are some examples of do's and don'ts of working with a kid with CAPD.
Susie, can you come? We're gonna eat dinner.
Mom!
Honey, we're gonna go have dinner now, okay?
Okay.
Come on, honey, we gotta go. Get your shoes on, get your backpack, get your coat on. Come on, we gotta go. What are you doing? Why are you just standing there?
I don't understand.
We have to leave. All right, honey, we're gonna go now. Can you please sit down and put your shoes on?
Yeah.
Thank you. Good job. You're doing a great job following the instructions. Can you get your backpack now?
Yes, I can.
All right, it's time to go. Honey, it's time for dinner. Can you please stop doing that and wash your hands and set the table? Okay, thanks.
Go.
Honey, it's time for dinner. Can you please wash your hands and then set the table? What did I just ask you to do?
I need to wash my hands and then set the table.
Good job. Hey, honey, how was your day at school today? Good? Yeah? Yeah, good? Okay, good, cool. All right, I gotta go. Hey, honey, how was your day at school today?
had a good day.
Susie, did you finish your assignment?
I did.
Awesome. You can just go ahead and throw it right there. We'll get it later.
Okay.
Susie, did you finish your assignment?
I did.
Good. Okay. Do you have your spelling assignment?
Yeah, right here.
Okay, perfect. Why don't you put that one in this slot? Good. And then is that your math homework?
Yes, it is.
Okay, good. You can put that one there then.
Okay.
Good job. Okay, we're going to start and look over our math that we talked about yesterday. So, Elizabeth, do you remember 2 plus 3?
Yes, that's 5.
Good, good. And Susie, how about 1 plus 4? Susie? Hey, Susie. Okay, guys, we're going to talk about the math that we talked about yesterday. So, Elizabeth, just to review, do you remember what 4 minus 1 was? 3? Good, that's right. Okay, and how about you, Susie? Do you remember 2 plus 1?
Yes, that's 3.
Good!
Go.
Okay, guys, so today we're going to talk about a kind of speech called nouns. A noun can be a person, like it might be Elizabeth, or it might just be a girl or a boy. And a noun could be a place. Yeah, Susie?
I didn't quite get that. Can you repeat it?
Susie, before we talk about nouns, do you have your pocket talker on?
Yes, I do.
Good. Okay, class, today we're going to talk about nouns, all right?
Now, after watching the video, we have a few questions to review. CAPD is a breakdown in communication between what two parts of the body? The answer is the brain and the ears. What are some common behaviors seen in children with CAPD? They have a hard time understanding speech in noisy places, following long conversations, reading and spelling, following multi-step instructions, maintaining focus, and remembering spoken information. What are some strategies you can use to help your child? Have a quiet atmosphere when speaking to your child. Use simple instructions. Speak slowly and clearly. Maintain eye contact. Stay organized in the classroom and use a visual schedule. Have the child sit in front of the classroom and have the child use an assistive listening device. Who will be part of your child's care if diagnosed with CAPD? An audiologist, a speech-language pathologist, the classroom teacher, a psychologist, and you, the parent. How did you do on the quiz? These answers and questions are the most important facts we hope you take away from this video. Remember, you as the parent are your child's greatest advocate. Thank you for your time and attention. We hope you enjoyed this presentation.